Hello, my name is Joy Ajibwe. I'll be performing the non-parental medication administration. I'll perform my hand hygiene. I'll perform my hand hygiene. So there are six rights of medication: the right patient, the right time, the right dose, the right route, the right medication, and the right documentation. The next thing is the PCP order. So for the PCP order, I have the physician order and the record and the medication record. So for the physician order, Buzajab MR 87134651, um Buzajab MR 87134651. Then the physician order, date of birth 6/20/19XX, date of birth 6/20/19XX. Then the physician order, I have cephalo 500 mg/POQ, 8 hours for infection. Cephalo 500 POQ, 8 hours for infection at 8:30 the both. Then for the physician, Syndred 100 mcg POQ AM at 8:30, Syndred 100 mcg POQ AM at 8:30. Nitrobit for the physician order, Nitrobit 2% ointment topical QAM 1 inch on patient chest at 8:30. Nitrobit 2% ointment topical QAM 1 inch on patient chest at 8:30. So the next thing is there are three medication I'm going to be verifying. One, I'm going to pull out the medication drawer and bring out my medication, which this is it. The second one is I'm going to be preparing the medication by putting the amount of medication. Then the third one will be at the patient's bedside. So here with me, the first verification, cephalo 500 mg POQ, 8 hours for infection. Cephalo 250 mg per ml. So I will calculate how much medication that I will be needing here. Here's my measurement cup. The next one is a Syndred 100 mcg POQ AM, which here is Syndred 100 mcg. I'm going to open it at the patient bedside and give him with water. The third one is the Nitrobit. For the Nitrobit, 2% ointment topical QAM, 1 inch on patient's chest. Same is also same here. And this is my measuring tape. I will put the number of I'm going to measure 1 inch and put it on the patient chest. So here with me I have the nursing drugs reference. I'll be hoping the cephalo, the adult PO 250 to 500 mg/q 8 hours. The max is 500 mg/q 12 hours, which this is on a high side. So I have to call my physician to know why my patient is on it, and also to know if there's any indication why this medication should be held. So for the side effects, dizziness, diarrhea, and also nursing consideration, and also to know if there's any fibroid, if there's any tissue, if there's any tissue, if there's any tissue problem, sorry, kidney problem. So the next one is the syndrome. So for the syndrome, the action is increase metabolic rate, controls protein synthesis. This is for fibroid. And also this, I want to know what my patient is diagnosed of. If the adult is less than 50, which is yes, and the max dose is one PO 1.7 mcg per kg per day. I have checked his weight, which is on a normal guidelines. So The the side effect is anxiety, insomnia, tremor, thyroid storm, and also I assess the blood pressure and to make sure that it does not get too high. The third one is the nitrobit. So for the nitrobit, the action is decrease preload and afterload and um, chronic stable and treat chronic stable angina, and this there is also sublingual, um, rector, topical, and also patch. So for the dose, I have 1 to 2 inches Q8 hour as it is needed. Which I'm done with it, I'm going to put it aside. The next one is I'm going to prepare the medication by verifying. Here I have cephalo 500 mg Q 8 hours for infection. Here cephalo 250 mg per ml, which I'm going to be calculating. 500 over 250 times 5 is equal to 10 ml, which I will be measuring 10 ml by putting the measuring cup down. I'm getting the right amount. Here with me is a 10 the 10 ml. So for the nitrobit, 2% ointment topical QAM, 1 inch on patient chest. Nitrobit 2% ointment. I'll be measuring 1 inch with the measuring tape on the patient bedside. So now I've gone to the patient room. Um, Hello, my name is Joy Ajiboye. I'm going to be your nurse for today. So I'll be giving you some few medication. So I'm going to provide privacy and also pull the curtain and perform hand hygiene and putting on my glove. So can you please identify yourself by telling me your date of birth, the name and your date of birth? So in doing that, I'm looking at my patient band to make sure that what it says rhyme with what I have on my book, which is same thing. So the next thing is today I'm going to be giving you your medication. Here with me, I have the antibiotic which you're going to swallow. Do you have any problem swallowing? Because oh, you said no because this is a liquid medication. So the next one is the Sindred. The Sindred, I'm going to open it, I'll put it in the cup and give you with water to use to swallow it. The third one is the Nitrobit, 2% ointment. Do you have any current patch on you, or you say you have on your left hand side? So I will take off the pouch on his left hand side with I will take it off and clean it with rag and put a new one at his right at his right chest. I will take off the old one from his right left chest, clean it off with rag and put up a new one on the right chest. And also please make sure that you don't rub it or cut it off. So the last the last check is going to so now I'm going to verify. So the last check is going to be on the patient bedside. So I'm in the patient bedside right now. So I'm starting by verifying the medication. Here with me, I have Cefalo 500 mg PO Q 8 hours for infection. Which here with me, I've done my measurement. I have 10 ml here. The other one is the Sindred 100 mcg PO QAM. Which here I have Sindred 100 mcg. I'm going to open it and give him water to also swallow with it. And the third one is a nitrobate 2% ointment, nitrobate 2% ointment, topical QAM 1 inch on patient chest. So since I'm done in verifying the order, the first thing I'm going to be doing is I'm going to be giving him his pill. This pill is for this I'm going to be giving his pill by opening it. This pill is for fibroid. I'll open it, put it in the cup, give it to my patient with water to swallow with it. Then the next one is the antibiotic. So for the antibiotic, I'll give him to swallow, and also give him little water also to swallow with it. So the third one is the nitrobic. So for the nitrobic, I will take off the old pouch from his left hand side, wipe it off, and I wipe it off with rag, and also put it on my hands, and I will take off my hand glove and trash it and put on a new glove. So I'm going to measure the nitrobic now. I'm going to measure 1 inch. So here is the nitrobic the 1 inch. This is the 1 inch I just measured. So what I'm going to be doing is I'll put this the nitrobic on his right chest by putting my initials, my I'll put my initials, date and time, and also I'll take off my glove. I'll take off my glove and perform hand hygiene. Then I'll put the bed down and wait for some few minutes for the nitrogen to be tolerated. So also I will ask the patient if there's any question, which and if I'll ask the patient if there's any question, and also put the call light beside him, and tell my patient that I'll be back in the next 30 minutes. So the next thing is sublingual. The sublingual medication is under the tongue, while the buccal medication is between the cheek and inside the mouth. So this medication will be given to patients without water, or the patient without water, and the patient is not going to chew it. So she is going to wait until the medication is dissolved. So the next thing is the high drop. So there may be a burning sensation and for the high drop. So I will apply a clean glove and have some cotton wool, and also I will lower the high lid. I will lower the high lid and ask the patient to look up to the ceiling and hold and hold the dropper above the conjunctiva sac, and install the prescribed number of drop, and also apply it gently apply the gently pressure, and also the nasolacrimal, just and ask the patient to close his eyes gently. So the next thing is the ear drop. So for the ear drop, I will warm the medication in my hands by feeling the room temperature, and also I will hold the pinna of the ear up. I'll pull the ear back. I'll put the ear back and up, which is for age 3 and up. Then I'll put the ear back and down, which is for age 3 and then down. And also I will install the number of drugs and allow it to stay for 5 minutes. So the next one is a nasal drop. So for the nasal drop, I will instruct the patient to breathe. I will instruct the patient to breathe through his nose and hold the dropper above the nails, and also install this prescribed number of drops properly, the prescribed number of drugs, and also has the patient to remain suspend for 5 minutes with his head back. So the next one is the enema. So for the enema, if the patient was to be in the bed, I will raise the bed to a working height, and also I will lower the side rail down. I will lower the side rail I will lower the side rail of the bed down, and also I'll keep side rail the left side rail elevated, and I will place the patient I will place the patient side seam with the right nail flex. I'll place the patient with the right nail um flex with waterproof padding, and also I will hold waterproof padding under the patient waterproof padding under the patient, and also I will assess the bedpan comma, and also the toilet. Then I will then apply clean glue. So I will lubricate for 6 to 8 centimeter of the tip. I will lubricate to 6 to 8 centimeter of the tip of the rectal tube, and also of the rectal tube, and also I will I will assist the patient to relax by breathing slowly in and out of the mouth, and of the tube inside the tip of the tube. So then I will separate the bottom and locate the anus, and inside the tip of the applicator slowly. I will inside the tip of the applicator um slowly to 6 to 8 centimeter towards the umbilical. Then hold the applicator in place. So and then I will then administer enema for commercial preparation by squeezing. I will squeeze the tube slowly to expel content, and also I will remove the tube that is covering the paper towel, and provide instruction to my patient. Then I will retain the solution until my patient I will retain the solution until my patient has the urge to defecate. Until my patient has the urge to defecate for 5 minutes, for 5 to 15 minutes. Then it all depends on the time. It all depends on the order and the reaction of the patient Although I will not flush the toilet. I will not flush the toilet if my patient expel. So I will remove my glove and perform hand hygiene, and also I will return the bed to the lowest position. I will turn the bed to the lowest position, and raise the side way up. I'll raise the side way up, and I'll put a cowbell at the reach of my patient. I'll put a cowbell at the reach of my patient, and also I will assess for any additional, in case if my patient is in need of any of or if my patient is in need of nurse. So by stating the time the nurse is going to be is going to be expected to return. So I'm going to dispose my PPE. I will clean or dispose any PPE if I was to be in contact with my patients. Then I will specify for manufacturer for manufacturer, and also I'll perform hand hygiene. Then I will document the time, the date, assessments, and the procedure, and also I will respond to the um and I will also respond to the procedure, and I will also respond to the procedure. Thank you.